next to the palpitations subsiding, that had to be the one thing that brought a smile back to my face, was just having that brain fog just lift. It's gradually just started to lift, and I could think it clearly again. 90-day difference, because I would just be sitting at home in bed and my heart rate would just be at almost 100 beats a minute, just lying as completely still as I could be and breathing as softly as I could. It would still be right at 100. And then a few weeks after I started the protocols, and even on the beta blocker, even after the beta blocker, it would still stay high. But a few weeks after my protocol, now my heart rate stays at, I have the little measure
finger,
yeah, and I was laying in bed some weeks back and it was at 58.
58. So yeah, so that's great. That's a good number. But how high, when you just said you were on the beta blocker, you were laying at home trying to rest, and it was still a little high?
A little high.
Like what number?
Oh man, it still floated around 90, 100 beats a minute.
90, 100 beats a minute with the beta blocker.
With the beta blocker, just resting.
Without the beta blocker, where was it resting?
Oh man, it would go, gosh, it'd be over 100, and then I'd stand up and it would go to 160 just from standing.
So with the beta blocker, it stopped going up to 160 on standing, but it still was down at about 100 while you were laying down in bed.
Yes.
And now it's at 58.
Yeah, it floats around 58 to mid 60s, just basically what my heart rate was before I ever had dysautonomia.
So without the beta blocker, and we're going to get there. So now that's good that you brought that up, is because even with the beta blocker, even though we're grateful that you didn't go up to 160 when you stood up, but lying down in bed, you were still around 100 with the beta blocker, and now you're at 58 with the beta blocker, 58 after this first protocol with me.
That's right.
So this has really brought it down significantly.
Yes.
Yeah. Is there anything else you want to tell anyone?
I would tell anyone that has POTS, who's watching this, who's really just looking for answers, because most doctors are just not going to give you answers as to either if you're looking for a diagnosis or you're looking to how do I get rid of this, because there's really no cure for dysautonomia. I would say try to find some way to come to South Florida, to Fort Lauderdale, and see Dr. Herman. There's too many testimonials of people with all kinds of different disorders who have found answers to what they're looking for, or treatment for what they're suffering through. And like I told Dr. Herman when I met him, I said I have full confidence that I will get better after I begin this treatment protocol with you. And after the first protocol, I've made tremendous leaps and bounds as to where I was. And so, Dr. Herman, thank you. Thank you a lot for what you do. And I look forward to going through this second protocol with you. And I would just tell anyone who's out there, just come see Dr. Herman, give him a shot, and you will have answers. I promise.
Yeah, thank you.
You're welcome.
That.
Yeah.
Thank you.